Thank you, everyone. Thanks for making it back to the FIT 2021 closing session. We're thrilled that you made it this far. We've had 3 great days together. We promise that your attendance in this closing session will be worthwhile. One quick reminder, please don't forget to watch your inbox today for an email from NNPHI. It will include the link to an optional training evaluation survey. Since you've attended FIT, we know you value continuous improvement as much as we do. Your candid feedback will help us to plan meaningful and responsive training events in the future. We definitely use all of that data to plan future events. The short survey is completely anonymous and should take just a few minutes. So our closing plenary is an exciting panel presentation today, focused on looking toward the future, and it's going to be a conversation on strengthening the public health workforce. We chose this plenary because of the strong linkage to our theme this year, optimizing your resources through performance improvement. We know that our public health workforce is one of our most precious resources, and we know you know that as well. So we brought together a fantastic moderator and workforce expert, Montrese McNeil Ransom, and 3 additional dynamic workforce experts who will discuss the current state of the public health workforce and share plans and strategies for strengthening our future workforce. We expect that this session will be lively with interactive dialogue with your questions and responses from the panelists. We're looking forward to sending you off with hope and excitement for the future. So take it away, Montrese.
Thank you so much for that intro, Lori. I am honored to be moderating today's closing session for FIT. This is the closing plenary session, and it is meant to mark the end of this event, the end of FIT 2020. But I want to encourage you to think about this as a beginning, not an end. We want to close this event by offering you a look forward, and that's really what this panel is poised to do this afternoon, to offer their thoughts on their vision for the public health workforce moving forward. And we have a stellar group of workforce development experts and leaders in public health joining me today. And I want to offer each of them an opportunity to introduce themselves and offer a little bit of context on their role as leaders and experts in public health workforce development. And then we'll turn to a moderated discussion. So, Brian, let's start with you.
Thank you, Montrese. I'm Brian Gastrucci. I'm the president and CEO of the De Beaumont Foundation. I spent 10 years in government practice, and one of the pillars at De Beaumont is ensuring that we have the public health workforce that we need to help communities achieve their optimal health. We have worked on things like the Public Health Workforce Interest and Needs Survey. We've worked on leadership development in the workforce. We are 100% dedicated and believe that governmental public health is the backbone of a strong nation. Coming through COVID, we hope that other people can understand this and reflect on the fact that, one, a lot of the death that we've had from COVID was preventable, and it happened because of decisions that we've made as a nation to defund public health, and that we should be very clear that the future safety, security, and economic prosperity of our nation is going to be 100% dependent on us rebuilding a robust public health system. And if we don't know that now, I don't know when we're going to learn it.
Thank you, Brian. Welcome. Heather, would you like to take the mic?
Thank you so much, Montrese. I'm very honored to be here. I'm Heather Krasna, and I'm the Assistant Dean of Career Services at Columbia University Mailman School of Public Health. I've been a career coach and career development specialist now for about 22 years, about 8 years working with public health graduate students and alums and all the employers who are excited to hire them. And in addition to my work at Columbia University, I'm finishing my PhD dissertation right now with the thesis topic of public health graduates in the United States, employment outcomes and employer demand. So I've been working with the Association of Schools and Programs of Public Health and many other colleagues and collaborators to finally figure out what public health students actually do when they graduate, and also who else is looking to hire them, and else being all the competition, unfortunately, that which is out there looking for our grads. And then finally, on top of that, I'm the author of 2 books, one of which is called Jobs That Matter, Find a Stable, Fulfilling Career in Public Service. That was in 2010. And then I have this new one, which is coming out, the 3rd edition of 101 Plus Careers in Public Health. Some of the folks on this panel actually are familiar with this book. This book is the only book in print in the US about public health careers. So I'm very, very passionate about the public health workforce. I think I might be arm wrestling everybody who's on this panel about, who's the biggest fan of all of our friends and colleagues here today in all of the public health departments. And so I'm thrilled to be here and excited to chat with everyone.
We are thrilled to have you, Heather. Thank you. And Patty, the mic is yours.
Thank you, Montrese. I'm really happy to be here with you and the other panel members to talk about this really important topic. I'm also a workforce enthusiast. I will be representing the federal perspective. I run a division at CDC that focuses on workforce development. We have a number of fellowship programs, including the EIS program, which people may have heard of before, other training programs for people coming into the workforce, but also people currently in the workforce, either in federal, state, or local public health. I'm also very involved in some of the new initiatives for workforce development, public health workforce development with the American Rescue Plan funding and some of the executive orders. So I feel like there are a lot of opportunities to address some of the challenges that I'm sure we'll be talking about today. Really happy to be here. Thank you.
Thank you, Patty. So as you can see, we've got the right folks in the room to be talking about workforce development issues. And while we want this to be a forward-looking panel, if we want to be clear about where we're going, we also have to really think about where we've been and where we are now. And so I want to start with a question around asking each of you to kind of reflect for a moment on the state of the public health workforce over the last year. What have we learned that can help us move forward? And Patty, since you're still spotlighted, do you mind starting us off and kind of giving us your reflections on what's going on? What's the status right now?
Thanks, Montrese. To me, I feel like the things that people who have been involved in public health workforce development have known for a long time have really been highlighted for the rest of the world. A lot of people have really seen now that how critical the public health workforce is, and how if we don't have the workforce that we need, our ability to respond to things like the pandemic is quite limited and doesn't get us the results that we want, like Brian said. Public health workforce has fallen behind in the number of public health workers we've had. We know that, but also in other areas, in the skills that people haven't been kept contemporary like they need to, the diversity of our public health workforce, and the systems that are needed to support the public health workforce have all fallen behind and desperately need attention. The other thing I would say is that we know that money is necessary but insufficient, that even though there's been a big influx of funds to state and locals because of how it came and how overwhelmed the jurisdictions have been, and the legacy of all the barriers that they faced up until this time, there are other things that we're going to need to do to really rebuild the public health workforce, and so money isn't enough. Lots of opportunities, but I'll turn it over to my fellow panelists to reflect and talk about that next time.
Excellent. Heather, do you want to share your reflections?
I'll echo what Patricia said, in that people who've studied the public health workforce, and Brian's been studying it much longer than I have mentioned for years that there has been a shortage, a shortfall, unmet needs in terms of hiring. And now people are finally paying some amount of attention to that. But the worry that I have, which I'm sure is shared by many, is that if there's only temporary influx of money, when that money goes away, what will happen to all those people who no longer are going to be employed? And there's so much work that has to happen for someone to get onboarded, to get trained, to be brought up to speed, to be mentored. It's that's my concern. And so I'm looking at how all of the funding is playing out. And I mean, I'm excited about that, and who couldn't be? And I'm thinking about, for instance, $400 million for AmeriCorps, Public Health AmeriCorps. I would love there to be a long-term plan where those folks who got excited and engaged, and they have the Fauci effect, and they're like going to public health school, and they're really gung-ho to be helpful, and they want to help all the health departments. Well, when that AmeriCorps service year is over, what happens to those folks? I'd love them to be tracked, to be engaged, to get a special scholarship, to go on for more education. Then they get into the public health associates program, and then they get into the presidential management fellowship program, or they go into local and state health departments permanently. There's a conversion eligibility, the hiring mechanism. That's a whole other conversation that we have to have about how people actually get hired and that process. So I think there's a lot of work to be done. I want to say, too, that fundamentally, I don't think we really even know how many human beings are employed in all the local and state health departments. That's an area of basic research. And then there's a lot more that has to be done beyond that to find out, well, how many folks are going to be retiring, or how many have left already, and then who needs to be backfilled into those positions, and how do you strategically plan ahead? So I'm hearing something secondhand because I'm in my ivory tower right now in academia, but all of my alums and students are out in the workforce, and this is what I'm hearing and researching.
Well, thank you for that, Heather, and your comments about using this opportunity to truly build the capacity of the workforce and grow the workforce, not just temporarily, but to really fill the needs, the gaps that we've been predicting for the last few years for certain. To that point, Brian, what are your reflections on the status of the public health workforce on June 9th, 2021?
I had to unmute. I'm ornery. Maybe, dare I say, I'm pissed. We knew this was coming. If China parked an aircraft carrier off the coast of Georgia, would our response to be cutting defense spending? That would be unheard of. We knew this was coming. We knew we cut the public health workforce. Every elected leader who has cut public health shares in the blood of 600,000 Americans on their hands. We knew this was coming. Tell me a foreign power. We spend $700 billion every year on defense. Tell me a foreign nation that has taken 600,000 American lives on American soil. Like, give me like one Predator drone every year. I can maybe make that work as a budget for public health. And we're celebrating $7 billion. Defense gets 100 times every year, and we're getting an influx. I think it's time for us to stop being nice. I think we should just put the Dixie Chicks on or the Chicks now. We should put the Chicks on a loop. I'm not ready to make nice. You know, our public health workforce gave everything that they could to fight COVID. We didn't give them enough. And that's on us. And so there are a lot of ideas. You know, let's have an AmeriCorps. Let's have a civilian corps. Let's get like basic, what does a health department need to be to provide services to its community? These should not be questions. And even when we have billions of dollars, we cannot have a public health system that looks like a Golden Corral buffet. In this state, we do this really well, but in this state, we do that really well. We need a public health system. We need to come together and protect our nation. We need to do it the same way that we defend our nation. We've been preparing for a war for a long time in this nation. We've been preparing for the wrong enemy. In 2002, 2001, Lori Garrett, others are saying this is going to be a problem. We got 20 years that we gambled, saying, nah, not this year. But we also have to understand that we had 121 consecutive months of economic growth through the end of 2019 and never increased the federal minimum wage. We know that. And so we need to start doing what we've said we want to do in the 10 essential services. We've refreshed that 10 essential services. We've centered it on equity. And now we need to live up to it. We owe the American people protection from health threats. And the federal government and state elected leaders owe us the resources so that we can do our job well.
Preach, Brian. Absolutely. Absolutely. Thank you for that. You know, this is a good segue question. I think, you know, my role as the director of the National Coordinating Center for Public Health Training, I've been asked a lot about my vision for the future of the public health workforce. And this week marks 20 years that I've been in public health. So I remember those predictions and those warnings. And I think that we're in a space now, you know, I see a workforce that needs to be competent in the basic principles of public health, but also in being able to apply health and racial equity principles, not just to the practice of public health, but to the internal policies, the decision-making, the hiring. I see a need for a workforce that's equipped to bring us closer to racial and gender equity, even within the field. And so I'm kind of curious, and Brian, you're on the screen. So I'm kind of curious, what's your vision? What's your vision of a future public health workforce?
I think it's a workforce that understands that health equity isn't a slogan. I think it's a workforce. In our PH-WIN survey, it's like 90% of the respondents said health equity is something their health department should work on. I think that's good. I agree with that. But then 10 percentage points lower said, well, we should also work on transportation. 10 percentage points lower, we should work on education. 10 percentage point lower, we should work on employment. So we want to work on health equity, but we're not doing the work that requires us to achieve it, right? We have to understand how, as not just a governmental public health workforce, but as an entire public health workforce, that we are championing those policies that change the game. You can change game pieces all day long. Let's just be super honest with each other. Hundreds of years of racist policy doesn't get undone by programs and interventions. It gets undone by policy. I mean, how in the name of God, through a pandemic, did we let the paid sick leave, the national paid sick leave requirements just go away at the end of 2020? I mean, we know, and this is the worst part, and not everybody's going to agree with this, but I'm going to lay it out. We know how to fix our problems. We know how to fix most of our social problems. We just lack the political will to do so. We need to find that political will, because even when you looked at the CDC guidance, all due respect, Patty, you know, things like, you know, if you're sick, stay at home. Not if it costs me my house or means I can't feed my kid. Or, you know, isolate yourself in one room of your home if you have the coronavirus. Well, I only have one room. We had people in New York City living 5 people to a 2-bedroom who had no protections legally. We know that when this eviction moratorium ends, there are going to be a lot of people on the street. And we're waiting. We need action. We need social justice to be a driver of our practice. And we need a workforce that's willing to do it. And maybe we need it in governmental public health, but we need it equally complemented outside of governmental public health. Because I know when I was in practice, there was only so much I could do. I can do different things now. And we need that symbiotic relationship to hold elected officials, corporate leaders accountable for the decisions they've made that jeopardize the health of our population.
Thank you for that, Brian. It reminds me, we need a public health workforce that is ready to dive into the muddy waters of advocacy. We need more training and workforce development around advocacy and public health for folks in governmental public health workforce and in the ways we can do that legally, and folks that are in the private sector and our partners outside as well. Heather, what are your thoughts? What's your vision of the future public health workforce?
You can see I was getting excited because you mentioned advocacy, and I did a little research on this. And if you add up the APHA and ASPPH and Trust for America's Health, and you add up everything they spent on advocacy, I looked into this, and it is about the same amount that was spent on one lunch from the American Medical Association when they were meeting they were giving a lunch to the staffers of the elected officials. So we do not spend on lobbying and advocacy. And I understand why. People are civil servants and they have a feeling that this is somehow they're not allowed, or you're a scientist and you should only speak from the truth. And we have seen, unfortunately, that when you have certain people in the room, the scientist's voice can get really squashed. And so I think it is important to step up and to advocate and have a voice and to learn how to do lobbying and advocacy work. And in fact, I'm hoping to be designing a massive open online course, a free course, specifically for the public health workforce and my students and my alums on exactly how to do this, because we need to do it. And it needs to be around things. And again, I'm speaking for myself right now, but the Public Health Infrastructure Saves Lives Act, for example, that's a really important initiative and a nice start. And again, I think even more is needed, but let's start with the basics. Even just getting enough sustainable forever type of funding is one of the key things that we also have to do. And policy, like Brian said, is hugely important, but also long-term permanent funding is really, really important. And somehow figuring out how to navigate getting that political voice out there to step up. And the other thing that I would love to see is for folks in public health to know that you are in like the most honorable and amazing profession there is. And to be really, really proud of that, which I know you are, but I've just seen people get so frustrated, burned out, and stressed over the last year, but for years before that. And I just feel like somehow government employees, there's this entire like negative narrative that goes on, and it's a political narrative. And I'm not having that. And none of my students are having that. And we just have to get that energy together and to make a connection between all the people that are passionately excited to make a difference and get them in the door with funding, with a great, clear workforce plan for every single local health department, for every tribal territorial health department, for the CDC, for everything, for the state health departments. There has to be a clear strategic recruiting plan with a message that speaks clearly to people about how incredible this field really is. And that's it. That's what I would see as
and retaining some sort of retention plan, Heather, right?
Well, you're right. And I put in the files a little blog article that I put together with my friend JP Leiter, who Brian knows too. And one of the things I mentioned is if you've got burnout, you have to use public health principles, avoid contagion, okay, do some promotion, try to keep that from spreading, and see, like, there has to be an infusion of moral support for people that have been struggling all this time too. It's a huge, huge challenge.
So I just want to add something. I like the positivity that you have there. And I just recently got a public health Eeyore tattoo on my chest. So I'm taking that role seriously. In 2017, our PH Wins data showed that half the public health workforce was going to leave by 22. If that was physicians, there would have been congressional hearings. So I love that we all love each other, but it's time to say to everybody else, we need to see more of the love. We need loan repayment in public health. That's simple, right? That's simple. It needs to be funded. Legislation exists. We need to get people into the public health workforce because they care about it. But listen, the expression of my care for my fellow man should not be at the cost of my poverty, because I can't pay my loan from my $70,000 Hopkins MPH or any other university, my Columbia MPH, right? And so this is how we show our love. We show the love by, funding public health, by having those congressional hearings, and that's what we need. I want Joe Biden, give me a public health czar. Right? Give me a public health czar who's going to really focus on putting the system back together, who can coordinate across USDA, CDC, NIH, and et cetera. So, Patty, next time you talk to President Biden, just ask him for the czar.
No problem, Brian.
Just make the request, Patty. Just make the request.
I do want to build on what my fellow panelists have been saying, though, about I think we have this opportunity. There's a lot of interest in public health. We know there's more graduates in public health, undergraduates in public health. We have a lot of younger people in the workforce who are very driven by the mission. And so we make it so hard for them to find jobs in public health. And so I think we can make a difference by giving people tools, learning about things that can really help people link them to jobs in public health. We need to do a better job of giving them applied learning opportunities, because then they're more attractive to jurisdictions to hire them. But then thinking about how to retain people, really need to help build a way to support lifelong learning and career development. People want to stay, but if they don't feel like that they're growing and developing, they're not going to stay. So there are things that we can do. We, as a public health community, give tools, give best practices, look at things that really work and try to implement them in a more systematic way in our public health system, so that we can attract and then hire and then retain the best and the brightest. There's a lot of people who would like to work in public health. They're not going to do it because of the money. The money's never going to be what it could be in other places. But if you have the other parts of job satisfaction and feeling like you're doing meaningful work and support for your job, then we can keep more people in those jobs.
I have to chime in on one thing. I'm so sorry, but
no, don't apologize, Heather. Carry on.
Just really quickly, what you just said. Okay, you want to entice young people to join the workforce. I just have to share an anecdote of something that I stumbled upon last night when I was looking at all the job boards of all the state health departments. I stumbled upon a job posting. I won't say what state it was. Here's how you were to apply to the job. You needed to print out an application, fill it out by hand or with a typewriter, and then mail it or fax it in. Has anyone here ever met someone from Gen Y or Gen Z who wrote that job description? They have not seen a typewriter. They don't use a fax machine. I'm just saying we need to go back to the basics for just a hot second and say, wait a second. When someone gets a first impression as a job applicant, you got to get it a little bit we could do better than that. I don't care who put that job posting together. I don't care what civil service rules there were in that state government about their job application process. But I was like, this is not acceptable. This is 2021. You're telling me you have to use a typewriter. I just was blown. My mind was blown. And I just had to share that because this is just the very, tip of the iceberg. But if you want to attract young folks, and not even young folks, like any folks into the health department, that first impression of the job application is something that people need to look at with some fresh eyes and revamp that. I know there's a lot involved with civil service hiring and rules and regulations. Believe me, I know about the GS levels and the competitive and non-competitive and every other thing. But I just want to say we need to look at that a little bit too.
Absolutely, Heather. This is a good kind of segue into opportunities. I heard opportunities across the board. At NPHI, we just released an environmental scan that focused on the challenges and opportunities for strengthening public health infrastructure. One of the core areas was obviously the public health workforce. And there were some specific opportunities that they pointed out, using community healthcare workers as a source for disadvantaged populations, as a source for care, opportunities to engage students, as Patty mentioned, through applied experiences and mentorship opportunities, but specifically with local health departments, and even opportunities to establish partnerships between universities, maybe even regional public health training centers, local health departments, and really broadening our training and continuing education focus. I kind of want to lean in on the opportunities. We're a forward-looking panel. So as you think about where the opportunities lie for us to build a strong foundation to strengthen the public health workforce moving forward, where are those opportunities? Where are the opportunities we can be leaning into now as we begin to mitigate our way out of this COVID-19 pandemic. Heather, thoughts?
The idea of academic health departments and a formal affiliation and a connection with the workforce, I will say, I feel that it's awkward for me speaking from Columbia University that I should say this, but there's not a lot of financial support within academia to make those partnerships happen either. And it's not that every university is as has had so many budget cuts as local and state and all the other government health departments have probably had. But it would also be a sort of good opportunity to think about how to create incentives and investments so that these partnerships have a little more sustainability. There's some incredible partnerships already. I think that I read a study that was talking about the most effective way to get new recruits into health departments. It was through internships and practicum opportunities. So I would recommend everyone to consider that as one of the opportunities. And the other challenge or opportunity you could say is to figure out how to connect the dots a little bit better, because you have each different school and each different major within the school sometimes has a different place for you to go and look to find candidates. And so figuring out a more streamlined mechanism where health departments can easily figure out what are the schools that have the majors or the students that I need, who's got the good nursing program that's in my zip code, for example, or the public health school that's in the area. I think those are areas that we could really, really grow. But there's huge opportunities to connect and to collaborate through service learning, internships, practicum, faculty partnerships. I could go on and on. I think there's huge opportunities.
Thank you. I want to pass it to you next, Brian, but I kind of want to set a little bit of a different context to the question. I read an article recently that said that 1 in 8 Americans, 40 million people, lives in a community that's lost its local public health department leader sometime during the pandemic. And we know that, I think the last number I checked, at least 20 states had lost their state level department leaders. And we know some of them left because of political blowback and pandemic pressure. Some left to take high profile positions. But we kind of knew this was coming. We knew that we were going to see an exodus of the governmental workforce. And even now, I think it's 42%, almost 50%, as you mentioned, of the workforce is over 50, about to retire. So sort of same question, but through your lens, Brian, how do we strengthen, support, and grow our public health workforce? How do we support what has to be this new generation of public health leaders in this paradigm shift that I hear you calling for?
Public health is political. We've known this. We knew it in the Reagan era. We knew it when we had to talk about links between breast cancer and abortion in our Title 10 clinics, in our in our breast and cervical cancer programs. I mean, politics has always been there. It has never been amped up to the point at which it is now. It is something that people are, the politicization of the country is being reflected in the politicization of the pandemic and the politicization of public health. I don't want a politician running towards me if I have chest pain. I want a physician. And I certainly don't want I don't want politicians practicing public health. We need to help educate elected leaders and business leaders that public health isn't a side of the aisle. It's the ground on which the aisles were built. And if you're a Republican or a Democrat, if you don't have a healthy constituency, then you can't graduate college, you can't graduate high school on time. You can't read at third grade level. You can't have an effective and thriving economy. And we have allowed this politicization of public health much to our detriment. If there's one thing that I would encourage anyone listening, I want you to look at all the people you talk to about public health. I want you to look at all of your friends and colleagues, and I want you to figure out what proportion are Democrats and what proportion are Republicans. And if it's not a 50-50 or a 60-40 split, you got a problem. We have to talk to everyone in our nation. We need, a Kansas Foundation just did a sermon guide for COVID-19 so that every religious leader giving a sermon can work in public health messaging. We need to reward and promote creativity and innovation. It is the single worst indicator in the PH wins data. Every time, less than half of the workforce says that creativity and innovation is rewarded in their health departments. And that's a leadership problem, right? And we have a leadership problem, and we know this in public health because our leaders are not merit-based, they're appointees. And we need to figure out how in every state, every community, everywhere, any physician requirement for leading public health needs to go. I'm not saying that a DRPH or an MPH is better, but I know there are a whole lot of people who could lead health departments, and limiting it only to physicians limits our imagination and our ability to deliver on the promises that we've made to the public. And so we need to really take on some of these structural issues. And these are national and state level fights that we need to have, right? The workforce, we can't put this back on the workforce because the workforce is just trying to get through. So I think we need Heather mentioned it earlier, we have no C4 in public health. Where is that? I mean, we can't lobby. I can't lobby. It's the one thing I can't do as a private philanthropist. I can't lobby. Right. And so we need someone somewhere. There's an alcohol lobby. There's a gun lobby. There's a tobacco lobby. But what's our lobby? And maybe we all need to think through how we get I think we need to get more politically active in public health. And I know that works against a governmental public health mindset. But, what we've seen the consequences of the systems that we have. And unless we change those systems, those consequences will repeat. And so if you're listening to us today and you have a unit of 5 people, infuse that unit with creativity and innovation. Ask them what they want to see. Don't just go with the kind of government steps we always take. It sounds cliche, and I'm sorry, but we have to, each of us, be the change that we want to see while we're moving the systems along. But there are definitely systemic barriers to, national systemic barriers to the appropriate practice of public health that need to be dismantled.
Absolutely. And my experience has taught me that politicians don't react to the science and the data. They react to the pressure. They react to political pressure. And so I think that's an important point. Absolutely, Brian. Patty, we've got a question here around internships and practicum opportunities. I do want to get your reflections on how we grow and strengthen our future public health workforce. But the question here says we focus on internships and practicum opportunities for clinical staff. What about for policymakers, quality improvement staff, IT staff, et cetera? Any thoughts on that?
Well, I think we need all of those. And we, even in my group, which is just a small number in term compared to the whole public health workforce, we do have different types of opportunities, policymakers, not so much IT, but more informatics. I think all of those things are important. We know that we need all those disciplines in public health. And so I think we need those opportunities and have people work in multidisciplinary teams. So I think when we can not just have the work environment, which we all have to work in multidisciplinary teams, but the training environment as well, to have people work together. I think they learn from each other, and the learning is more rich when we can do that. So we're doing some different models, trying those out in my group, and trying to support those also with through our public health partners in state and local health departments. So I think that that's really important. And I also saw in the notes talking about paid internships, and I think that's really important. And we need to make sure we're supporting that. And just while I have the microphone for a moment, I do want to really echo the student loan repayment support that others have voiced. We know that there's been a long history of federal government using student loan repayment and scholarships for public service. And so I think that it's a really great opportunity because people have to sign a contract to do some years of public service after they get the student loan repayment. So it's a really great way to get students what they need to help pay those loans, remove that barrier for people who that would be a barrier to public service. And we know that once people work in public health, a lot of them catch the bug and like to work in public health long term. So we just had the 70th anniversary of EIS, and I can't tell you how many people said they thought they would just come and work for 2 years and then go back and do whatever else. And once they really got into working in public health, they spent a lifetime, a career in public health. So if we can get people, and then, like I said before, if we can make sure there's a good learning environment and other supports for them, maybe we can keep more people too.
Absolutely. That's my story, Patty. I came in as a PMF on June 3rd, 2001. I'd like to tell the story that my public health career began on the cusps of 9/11, and we've got this next generation whose careers are beginning on the cusp of COVID. And I really think that there's an opportunity to really change things. This new generation has an opportunity to come in and shake things up. I feel like that's what happened in my year, although there's some things that still need to be changed. I asked the question about student loan repayment first coming into public health, and they were like, oh, we're working on that. We're working on it. And then there was you've got to pay for 10 years and you can't ever miss a payment. Those rules make it a little difficult. And I'll also say applying for a federal government job is so hard that if I hadn't come in as a presidential management fellow, I don't know that I'd still be doing this work in public health. I don't know that I'd even made it into the field. So that does matter for sure, making it so that folks who have an interest and the capacity and the potential have a way to get in. And that kind of leads me to the pipeline question. But it looks like Heather's got a thought. Heather, am I reading you right?
You do. You're good. I have no poker face, so you got me just right. I just wanted to piggyback a little bit on the unpaid internships and student loan forgiveness or repayment, whichever way it goes. So I just want to share, and people are probably familiar with the National Health Service Corps, the loan forgiveness that physicians and nurses are eligible for if they work in certain jurisdictions that have, I guess, shortages of these clinical staff and so forth. My understanding is that that particular program was created partly through lobbying from medical students. There's an association, the American Medical Students Association. It happened in the 70s. Partly because people did not want to get drafted for Vietnam, actually. I read a whole history of this original legislation. But it was medical students who would come in as a group of the students and lobby. There is no student association for public health students. There's the APHA Student Assembly. Anyone who likes public health can join that assembly. You don't have to be a public health major. The leaders actually are not necessarily only public health students. They're like MD, MPH. And again, I'm not critiquing MDs at all. I'm just saying there's not a voice currently that I know of that is purely the voice of the public health students. Do you know how many public health students there are in this country? Every year, 35,000 of them are graduating. 35,000 of them. And do you know how many of them start their first job in the government at all? Forgetting what level of government, it's 10% of the undergraduates, 10%. And for the masters, which is mostly the MPH, it's 19%. And so if you just did the back—
Where are they going, Heather?
They are going to hospitals, corporations, for-profit consulting firms, tech startups. My students now get a job, my epi grads, epidemiology grads, okay, biostatistics grads. They can go become a data scientist at Fitbit or Google or any number of cool-looking, sexy startup techie companies where they play foosball and have lunch together, and it's like a whole other planet. They can quickly get a cool job at these companies. And yet there's still opportunities to lasso those students and get them excited about public health. There really is. If you speak about your mission, that is really going to resonate. Again, just focus on the mission and put a face to it, put some videos together, make it exciting. And you could probably compete with all of these other more sexy companies because you have the mission. And people see that, and they see it more than ever right now. So I'm just saying, there has to be a lobby from the student side. That's totally untapped. And there also needs to be really some thought around unpaid internships, because unfortunately, that's also an equity issue. My students sometimes cannot take an unpaid internship financially. So we have to think carefully, is there funding from somewhere that can go out to pay for these internships so they can compete? Because again, if you can grab them with an internship somehow, then you, like you said, they can be roped in and they'll be staying forever because they see it's the mission. And so that's my 2 cents about that. There needs to be a student voice on top of what Brian said about a public health workforce lobby. It needs to also be part of a student lobby too. Yeah.
Well, we are coming up on time. So what I'd like to do is offer you each 30 seconds to offer a closing comment on your top tip, thought, idea, comment around strengthening the future public health workforce. Brian, what would you offer?
If we want public health, we need to pay for it. And that's not just the federal government. We need states to create taxes. We need local entities to create taxes. I pay a bag tax in Montgomery County, Maryland, 5 cents for every time I use a plastic bag. That's generated millions of dollars. Why wouldn't we do a 5 cent cigarette tax, 5 cent alcohol tax if it's within our legal authority? But we can't continue to look to the federal government every time we want to support public health. When I was in practice at the state level, 95% of my budget was federal. And so how involved, how engaged is the state when the federal government is saying, well, we're going to take care of this? We can't assert local and state control over governmental public health, except when it comes to funding it. Right? It doesn't work that way, and it shouldn't work that way. The 10th Amendment to the Constitution says that the public health is the state's right, is the state's responsibility. And so states need to generate the tax revenue. Put a 5 cent tax on every license, right? And 5 cents over a lot of people makes a lot of money. If you've ever watched Office Space, you know that. And if you haven't watched Office Space, you should. But that's what we have to do, is we have to generate a revenue. We have to get people invested in public health. We can't just wait for politicians to send us cash.
Thank you. Heather, 30 seconds.
I'm just going to say that the 1915 Welch-Rose Report, which was what founded the discipline of public health as an area of study and created the very first public health schools, that original statement, and I can argue about the history, and there's a lot of history that is not awesome, but that original mandate stated that public health schools have, as part of not their only job, but a chunk of their job should be to prepare people to be public health professionals. We don't just have public health professionals only in government. That's true. Okay, people are public health professionals who work in nonprofits and universities and research institutes and all kinds of places. And we all have to work together as the public health community and ecosystem and all of that. But at the end of the day, if the universities are failing to get our students into the core public health workforce, which is everybody here on this call, we are not fulfilling our mandate as a university. This is my deeply held view. And I'm not saying that, again, that's our only job. We have to do research, we do service, we do all kinds of education. We are mandated to work with our communities. And I just feel like there's a lot of work to be done to improve that connection between our 35,000 grads every year and all of the folks here on the call. And we can make it happen. We just have to work together. There's a lot of barriers. There's a lot of policies that would have to be kind of untangled. And I agree with everything that Brian has mentioned also about the funding and how that needs to happen. But this is our job. I mean, this is my entire job right now, is to help my students find employment. And I would love it to be with any of the organizations here. And I could say the same for any other public health school. That's my 2 cents.
Thank you. So Patty, I want to let you do your 30 seconds, and then Lori Call, I'm going to pass it to you to close us out. Patty?
Thanks, Montrese. I would just say that we do know that there are a lot of jurisdictions who've made great progress in these areas, and even with a lot of facing a lot of barriers and adverse conditions. So we need to learn from each other and share with each other so that we can find out, and everybody doesn't have to learn for themselves, what kind of things work. Look for best practices, look for tools that will help, and work as a community to help everyone. So look forward to future discussions with everyone and learning more about things that work.
Thank you. I just want to say that I've enjoyed being here and learning with and from each of you. Thank you for having me as your moderator. And Lori, take us on home.
All right. Thank you so much, Montrese. And thank you, Brian, Heather, and Patty. That was really exciting and inspiring to be able to hear people really advocating for our public health workforce and giving us some advice on what we need to start doing. We'd also like to thank all of our workshop facilitators and presenters. Wow, they really put together some great workshops. And I hope you'll continue to listen to those that you didn't get to see. The recordings will be posted shortly if they're not there now. They took a lot of time in developing those, so we are thrilled. And we'd also like to thank all of our partners who are involved in planning and provided moderation support from all of the national organizations. And thank the NMPHI staff. Megan, you did an outstanding job leading the planning of this event. Melissa, Carmelita, everyone who was working behind the scenes and helped put this together, and the technical team, we're just thrilled to have all of your support. And finally, FIT would not be possible without the support from CDC's C-Stilts. Thank you to Liza, Doha, and Brittany for all of your support and planning and guidance and putting this great panel together. And thank you all for your participation. Without you continuing to advocate for performance improvement, lead the efforts when you're not always the most popular person in the organization, we applaud you, we thank you, and we are thrilled that you joined us this year. We look forward to seeing you next year, and we hope it's in person. We're working on dates right now. Thank you all and have a wonderful evening.